Welcome back to Mornings at ANC. Many people have the wrong impression that hair loss is just for the elderly. But the truth is anyone can suffer from hair loss, which is also called alopecia. Aside from stress, there are other factors which cause hair loss. And to tell us about these factors and tell us more about hair loss is Dr. Julieta Arambulo, a derma hair transplant specialist from the Medical City. Good morning, Doc.
Good morning.
Okay, well, first of all, when people have, various, I guess, understandings or conceptions of hair loss, we go from balding to actually suffering from a more severe level of the disease. Maybe we can go from, if you can kind of roughly explain hair loss in general and when people are expected to start suffering from certain forms of hair loss.
Okay, there are different causes of hair loss, and I will share my experience, the kind of patients who come to me for hair loss problem. The first one is the least common hair loss caused by infections, such as fungal and bacterial infection. If they're not treated, they'll lead to scarring.
Okay.
And the second least common cause of hair loss problem is caused by thyroid problems. Also, there will be some patients who are anemic, may present with hair loss problem. Now, the most common ones, there are conditions called Alopecia Areata, and these are the patients that you see with patches of hair loss that may be solitary and may be multiple. Sometimes it may involve the entire scalp. And then there's a telogen effluvium that is called, and this is caused by stress. So I've been talking to people at the dressing room, and they're talking about it, and there's so many people here suffering from telogen effluvium because of stress.
Oh yes, definitely, especially here in the news.
And the most common one is the caused by hormone androgen. This is called androgenic alopecia. And this may affect both male and female.
Okay.
And these are the people that you see with pattern of hair loss. Sometimes you see only the back hair.
Okay. And that's when it kind of goes into a little bit more serious, forms of hair loss. Doctor, I want to ask because it is normal for you to lose hair when you brush your hair, or when daily. I mean, there is a cycle that your hair goes through. When should people be alarmed that they are starting to lose too much hair?
A normal individual has an average of 100,000 of hair, okay, and 90% of this is in the actively growing. Now, you are allowed to lose 10% of the 100,000,
okay,
and that is an average of 50 strands to 100. In some patients, 150 strands are still normal to lose every day, but they will be replaced by new ones after 3 to 4 months, and that's the good news.
That's the good news. I mean, and for patterned baldness, that's usually genetically determined, or that's a big factor.
Yes.
But for those that maybe aren't necessarily going bald but are losing a lot of hair, is there something that they should be alarmed of if it gets to a certain point that the hair, in addition to other symptoms, that may really be a more serious form of alopecia?
Yes, they have to consult, because as I said earlier, there are various causes of hair loss. We have to know what's causing the hair loss problem so that we can treat, okay? Because most of them are just due to stress. And there are treatments we can suggest, they can try the topical and oral medications we can give them, and then after some time, if they're not happy, then there's another option that we can suggest, and this is the surgical option.
Right. Okay. We'll talk about that option a little bit in a little bit. I was just wondering, pwede ba maagapan ang hair loss? I mean, there are some men or young women at a young age who feel like they pay attention to it, and once they see some patterns, is there anything that they can do that they can slow down hair loss? Or?
Yes, it depends on what kind of hair loss problem the patient is suffering from. As I said earlier, if it's from the infection, we give the treatment. No, if it's due to stress, then we send the patient for stress management. And if this is due to hormones, especially in women, then we refer them to OB/GYN to work on their endocrine problems.
Okay, okay, and all of that, of course, is with a consultation of specifically a personal consultation with a doctor to find out specifically what it is that the patient is concerned about. But I mean, as we mentioned, there are other options aside of the topical and the topical cream that maybe that you can use, or other solutions. You said that there's a transplant. I mean,
yes,
people can. That's a viable option.
So the transplant is an option, and a very good option, because for patients suffering most of all from androgenic alopecia, because the result is permanent, and with improvement in the technique, the outcome is natural. So you can hardly tell whether the patient is has underwent hair transplant or not.
Tell us about the process, doctor, of the transplant.
So if you see some patients, the most severe type of hair loss problem in androgenic has the pattern of type 7. When you say a person is in type 7, you can see just the back of the hair are left. So that's where we get the hair to be transferred on areas that thinning. Okay, why you get the hair there? Because the hair there is not affected by hormones. Because in androgenic alopecia, the cause is the hormone called testosterone, which is converted to dihydrotestosterone. And those are, for unknown reason, the hormones affect only the hair follicles that's located in the frontal areas and the sides.
Okay.
Okay, so in hair transplantation, we get the hair that is not on the back, and we call it occipital area, that is not affected by hormones VHT. Right? And whether if you place it here on the front and on the top, on areas that are balding, it will not be affected by hormones. And that's the good news about hair transplantation.
And that's why you were saying it looks very natural. I mean, you're literally taking your own hair and transplanting it to a different part of your head.
Yes, because of the technique now.
Okay, okay. Is it the actual technique? Is it something that people should be quite fearful of?
Yes, the old one is the strip FUT. We get a long hair strip on the back, and then we dissect. I have a staff, a well-trained staff, to dissect it into single units, single units. We call micrograph, macrographs. It depends on the grouping of hair. That's why it will come out natural, and then we'll transplant it on the thinning area.
So even when you transplant it to a part of the head that is affected by hormones, the fact that it was from the back of the head that's originally not, or naturally not, it won't go away again.
It will not be affected by that's the good news. It will not be affected by the hormones.
Okay. And how many treatments will it take to actually?
It depends on the pattern of hair loss and the severity of the hair loss problem of the patient. So the patient may undergo 1 or treatment sessions.
So it could actually be solved in one. I mean, of course, varying.
Yes, they'll see result in 1 session.
Wow. Okay. The people who actually are your patients who actually go for the transplant, are they more prevalent in? Is it more prevalent in men or in women?
Mostly men. But now this year I've been getting because they're more aware of that there is a procedure called hair transplantation. They know that it's effective. Even young ones, as young as 25 years old, they come for restoration, hair restoration. However, we're cautious in doing this kind of patients. We make sure that we explain the procedure to them. They understand the procedure very well, because we cannot do big sessions in young patients because their condition is still progressive. So the good candidates for hair transplantation is our patients 30 and above.
I see. Okay. And just very quickly before we go, are there other benefits aside from aesthetics, of course, that I'm sure a lot of people are concerned about? But are there other benefits health-wise, as far development-wise, of the rest of your head and the rest of your body if you want to go get the transplant?
Yes, I will just share my experience. The patients that come to me, they're affected by it. No, they say they lose their confidence, so they want to restore their hair back. And so after procedure, they grow hair they're just so happy, and they say, you bring back the confidence in me.
So it's really mainly drawn by aesthetic
Yes, it
aesthetic
brings
reasons.
back the youthful appearance plus the self-confidence.
Okay, well, wonderful. Thank you so much, Dr. Arambulo, for sharing with us this technique that is now available at Medical City. Is it prevalent
Yes.
also in other parts of the country, or
Yes,
specifically
we
at Medical City?
are. We offer this service at the Aesthetic Center of the Medical City.
Okay, thank you.